Hi everyone, my name is Katrina, and in this video I'm going to talk about sacroiliac joint pain. So sacroiliac joint pain is really common in a lot of my pregnant and postpartum clients. Now, sacroiliac joint pain is simply pain located along the sacroiliac joint. So here's the back of my pelvis, and we have our SI joints right here and here. You have a left one and a right one. Now, these sacroiliac joints have the ability to move. There is about 3 to 5 degrees of movement at the sacroiliac joints. Now, sacroiliac joint pain is really common throughout pregnancy and postpartum. And I think a big reason why that happens is simply our posture, how we stand, how our hip and feet alignment is set. So the reason that may be is because how you stand, how you position your hips and your feet will affect what happens at this SI joint. Now, a lot of people, when they're working on SI joint pain, they tend to work on core strengthening, maybe some glute strengthening, maybe stretching out the pelvic floor. And while all those are great things, I think it's really important to look at the bigger picture in seeing what may be happening with how you're standing throughout pregnancy and postpartum that could be causing the SI joint pain. So the SI joint, it has the ability to compress, so this motion, but also, compress, but also open up. Now, a lot of people, when I notice, we tend to stand externally rotated. So our hips are externally rotated. Oops. Our hips tend to be externally rotated like this, meaning our hips and our feet are turned out. So if you are standing right now, just stand up. A lot of people are turning their hips and their feet out. Many people, when they walk, again, they're toed out. So when that happens, and that, again, it will happen a lot throughout pregnancy and postpartum, and I'll show you why, that causes a lot of more closure or compression at the SI joint. Now, the reason why this happens a lot throughout pregnancy and postpartum is because when your body turns your hips out and your toes out, that is because the body is trying to create more space for the baby. So as the baby grows, when you turn your hips and your toes out, it opens up the pelvic inlet. The pelvic inlet is this top inner rim of the pelvis. It opens up the pelvic inlet so that the baby has more room to move and grow, and so it can drop into the pelvis to prepare for labor. So again, this is very natural. Many people, when they're pregnant, they will toe out. They will turn their hips out. They will externally rotate their hips. They will externally rotate their toes and their feet. And that is because it's trying to accommodate for the baby and trying to help open up the top of the pelvis. While that is good, again, what can happen, it can cause a lot more compression and closure in the SI joint itself, causing sacroiliac joint pain. So that is one of the most common reasons why I see SI joint pain. And one simple way to fix that is just how you stand. So instead of standing with your hips and your feet turned out, look down at your feet and try to have your feet facing forwards. And it's a very simple tip, but that will help naturally lengthen your glutes. It will help decompress the SI joint and just create more space and like jiggliness in your glutes. Because when you are standing with more hips externally rotated, toes out, there's a lot of tension, compression, just tightness back here. And we don't want our bodies to be so tense. We want to be able to have nice and elongated and lengthened and mobile muscles. We don't want to be in this clenched, tight position. So if you've been struggling with SI joint pain and you've been doing all the core exercises and glute exercises and everything like that, try just changing how you stand and let me know how that feels. And if so, if it helped, please let me know in the comments.